Now, let's take a look at how we can influence decisions. And what we're going to do is we're going to map out a little bit of some theory around decision making that hopefully will provide you with some useful tools. Particularly if you are in a situation where you have consensus decision making. And a lot of alliances, even if they don't contractually require consensus, try to achieve consensus. And there's many different levels of consensus. Consensus does not mean unanimous agreement. It might be that everybody can say an unqualified yes, but it might also be that somebody's willing to accept the decision. They don't fully agree with it, but they're not going to block it. They'll support it and move forward. So you really have to be able to work with your stakeholders to get everybody to the point where they're willing to say, yes, let's move forward. And this is how we are going to move forward. Of course, you want to pay attention to those who perhaps are in the latter camp saying, I don't fully agree with it, but I'll go forward, because you want to make sure that you're keeping them informed about data that supports the assumptions that were used to make that decision, because you don't want them to be folks that are sticking their foot out, right? So you have to pay attention to the degree of consensus that you have. And you also have to really look at things from the standpoint of, how do we approach big decisions in particular to prevent delays and to prevent suboptimized decisions? So you really need to work with your team to plan the decisions. So that starts by making sure that you understand how this decision is going to fit into your internal decision process, yours and your partners, right? And look at, if it's a big decision, look at it and understand what perhaps you've already agreed on, and winnow it down to the key areas that you really have to discuss, debate, decide. And then you want to appropriately frame it. What's the problem statement or the opportunity that you're pursuing? Work with your internal team, right? Make sure everybody understands what that decision is, what the pros and cons are of various options, that everyone has the data that they need. And you also want to make sure that you develop strategies to manage the risk of delay. And one of the things that you can do that can really help influence that decision and can help drive it forward is if in your planning you are looking at your value inflection points and you're thinking about the decisions that have to be made in conjunction with them, and on your digital platform, you are planning out that decision. You're putting it out there with an approximate time frame as to when it needs to be made, and you're looking at all of the deliverables that have to be produced and the internal governance meetings that have to be consulted about this, and you've got a whole plan for your decision, and you are proactively managing that. When you can do that, you're going to be better able to influence stakeholders, to have the discussions that are needed, and you're bringing them all the data, so they're going to make a better quality decision. And you're going to be the one that they look to and say, okay, you have helped us make this decision and helped us move along. That's true value to your stakeholders. And when we talk about major decisions, we can bucket them in a few categories. How'd that get color on it?
Huh?
That was a black and white icon. How'd that happen?
I don't know.
Okay.
He wants to stand out.
He wants to stand out, for sure. All right, so a few major decisions that you really do want to plan going forward. So things like where the alliance has to make a decision on which indications you're going to pursue in your life cycle management plan, or if you have to decide which partner is going to lead the clinical development efforts. All of your annual plans, the functional and regional plans and budgets, development, commercial, medical affairs, manufacturing, you need to orchestrate these, and the decisions that go on around it. Your publication and Congress strategy and plan, who's going to do what, Are you going to both share a booth? Well, what about the rest of the portfolio? How does that get represented? Which publications are you going after? Are you timing it for a data reveal, and a Congress? All of these are major decisions that need to be made, as well as looking at your regulatory strategy, the content of submissions and communications. These are areas where the Alliance Manager can really bring their ability to influence the stakeholders, to engage in the activities that are needed to make sure you get a high-quality decision in a timely manner. And so just a couple of tips for thinking about how to really orchestrate these. So you want to use your North Star to brainstorm what we call the greatest value objective. What is it that is going to create the greatest value for the partners and the patients? Really put that out there as your key objective, and then frame it, right? Be very specific about what the opportunity is, what's the problem that you're trying to solve for. And then actively manage the different opinions that people have. Don't stifle them. You want to hear the different opinions, because that's often where innovation comes from and a better decision will come from. But don't let it, it take over the structured decision making that you're having. And then just always keep your focus on that greatest value objective. And so here's a little process. We actually go through a process for making a consensus decision. And I understand this might be a bit small in the back. Don't worry, all of these will be available to you. So you want to align. You start with aligning on the greatest value objective and frame the concise opportunity or problem statement. You probably need to consult your internal governance, either before, during, perhaps after you are looking at things from the standpoint of what it is that's going to create the greatest value. Ideally, what you want to do is to have guidance from your internal governance. You work this together as an alliance, and then you're able to develop a proposal collaboratively. What you don't want to do is you don't want to have a fixed decision made internally in your organization. Here's what we want. And then you take it to your partner and say, here, we want you to align with this. Right? What's going to happen then? Your partner's going to be defensive. They will rebut the decision. You're setting yourself up to have stalemate, potentially, almost always a sub-optimized decision, because the natural tendency will be to try to come against what it is that you have done. So get your internal guidance, work your proposal collaboratively, and then see if there's consensus. And if yes, then you implement the decision and you make sure that you identify the key assumptions underlying that decision to monitor to know whether or not they were valid or invalid. If you don't have consensus, you put together a proposal, it's been developed together, but perhaps you don't have everybody on the team aligned around it, then you really need to think about, are there underlying interests or concerns that aren't being addressed and that could undermine your proposed greatest value objective? What have we not covered in what we're proposing as a decision, as a solution moving forward? You have three options at that point. You can go back and modify the proposal and see again if you have consensus, or you could agree to just go along and we'll see what happens, or if there's no decision, you're basically stuck at status quo. But you have the ability to influence how the teams have their discussion and the things that they consider at each and every step along the way. And what you need to keep thinking about is keep paramount that greatest value objective, what it is that you're trying to achieve, and think about what they need in order to see each other's point of view in order to be able to arrive at an appropriate decision. And then you practice the give and get of reciprocity. And I'm sure a lot of people have seen this diagram before, but what I want to point out here is that what you're trying to do as you're influencing the outcomes is you're trying to create as much value as possible for the parties. You want to get as close to that 100% of a truly collaborative solution as possible. You don't want to start saying, well, let's compromise and everybody only gets part of what they want. It's a mindset to say you're going to try to achieve as much as of what you want as you possibly can. And if you look at that chart, you can see that the area where the golden arrow is really represents, 4 times as much value as if you settle for half a loaf. You'll never get 100%, but you want to try to get each partner as much of what they want as possible. And you use the currencies, the expertise, the resources, the commitment, alignment, sources that bring you about those outcomes in order to really achieve your overall objective. Right? As we all know that when you compromise, when somebody walks away and they're not happy, that issue is going to come back for sure. And so you want to try to resolve as well as you possibly can.